Hello everyone and welcome to SR Live. My name is Katarina, one of the investment analysts here at SyndicateRoom. Today we are joined by Nigel Biggs from True in Vivo. We will be starting with his elevator pitch, which he did recently here at SR Live, as many of you will know. Just to refresh our memories, as usual, please submit your questions, which we will go through after my quick questions.
Imagine thinking that your child's jewellery beads could be the answer to a global problem in radiotherapy. Over 9 million patients worldwide are treated for radiotherapy every year, but unfortunately around 1 million of them are damaged by their treatment because clinicians just cannot see the dose that arrives in the patient. True in Vivo has found a great way to use glass beads to measure radiation in body, something no one else can do at the moment. This delivers confidence to the clinicians, it saves damage to the patient and the related medical costs. Our technology is also applicable to nuclear decommissioning, animal health, defence and aerospace. We are now raising funds on SyndicateRoom and we really hope you will look at the opportunity to invest.
Thank you very much for joining us today, Nigel. So you are currently in overfunding, as I understand, and you've got a day to go, which is fantastic. Congratulations. So let's just start by talking a little bit about the production process and things like that. How's the progress gone with that?
Well, I'm really delighted to say that the whole pre-production reader development is on target still. At the end of June, we get our first device out of the production company, and that goes straight into a hospital partner for testing.
All right, and with respect to partners then, how are partnerships developing and are you continuing to pursue those things?
Well, when we were here last time, I talked about the 3 partners we have and another set of hospitals already trying to get on the list. And one of those, Exeter, had said they wanted to join us. And in fact, what they've come back with recently is they want to do a national audit using our equipment. So they're one of, I think, 3 or 4 now that said, when can we buy a reader? Which is great. I mean, it won't be to the end of the year, but that's good news.
Very good. And so with respect to universities, I understand that's something that you're pursuing.
Yes, because we have a relationship with the University of Surrey, which is where the patent was first done anyway, before transferring to us. And Shakar, our founder, is still a visiting researcher there. Okay. And they have selected our technology as a key impact technology for the university. And we won with them funding from the Institute of Advancement of Science, and we're joint sponsoring a 2-day conference at the end of June, and 3 speakers are people who want our reader, one from France, one from Germany, one from Iran. So that's
convenient.
Pretty
Excellent.
Positive.
Very positive. And then with respect to the regulatory front, how are things progressing there? Because I understand you were...
Yes, our regulatory nominated body is BSI, British Standards Institute, and we're off to an exhibition next week, which you might just ask me about. But after that, in May, is our first visit by an auditor to have a first look at us, and then the next one's in July, and the final regulatory one is on target for the back end of September.
Okay. Any concerns coming up with that visit?
No, we're very lucky because my engineering director and I have been through regulatory and medical before, some years ago, for another company. And although this is different in that it's in the body and things like that, the basic mechanism is the same. We have a consultant anyway who helps us with things like how we do sterilisation of catheters, which I've never done before. So that's useful to have the right people helping to do that. So we're on target for that as well.
Excellent, fantastic. And you mentioned that you have a conference next week. Can you expand on that for us?
Yes, the conference in Milan is called ESTRO, which is the European Scientific Conference for Radiotherapy and Oncology. It's the best one outside of the States. Shakar and I visited it last year, waving our beads, and that was it. This year we have a startup stand there, and we got really good interest last year, and I've written out to the people that wanted to see it, and we're getting people saying, we will come to your stand, which is good. And we're also doing a talk on, or Shakal mainly is doing a talk on how to go from being an academic to being an entrepreneur. So that is to clinical people, because that's the conference is mostly clinical. That gives us new potential clients.
Okay. So beyond potential clients, do you have any other objectives for the event?
Well, always for the event. There's two things really. One is to get more hospitals lined up, but the exhibitors are the industry. And that means that last year we had one very large company say they thought we were onto something very special and wanted to help us. And I'm hoping we can extend that relationship into see what else they can do for us. And they won't be the only ones. So our target is to really build on the interest we had last year, but turn it into real collaboration.
Fantastic, excellent. And then I suppose, given that you are in overfunding, what are your intentions for the use of that perhaps additional money that you have been able to acquire?
Well, the additional money means that we can get on with all the things that we have in the plan, of course. And the best thing is, well, absolutely we can get to regulatory approval very nearly anyway, just on what we've got, which was always our main target. But it also means that we can do more work on beginning talking more commercially to customers. It's always difficult to decide when to take on a salesperson or a more commercial person. And what I see is that extra funding gives us a chance to do that a little bit earlier. That's the core difference. We will be quicker to market.
Fantastic, excellent. Thank you very much, Nigel. That's it for me now. Over to Tom with some additional questions from investors.
Hello, yes. Let's kick it off with an easy one. Last year, in April of 2018, you raised a similar size round of £300,000. What would you say you've achieved with that £300,000? What have been the milestones?
In very simple terms, we built our prototypes. We only had concepts to show people and talk about before we raised that money, and we said what we wanted to do was build the prototype reader and some prototype dose mappers. And the reader, we solved quite a few problems in that time, which has been very good, so that money got us to the point ready to raise this round, as well as starting getting the prototype readers into our manufacturer, and that's why we've started getting the pre-production ones in line for June. So what we've achieved is, from an idea and a concept and some slides and waving some beads, to a real, about to be a real production reader.
Okay. And then in following on to that, the current round, how far will that get you, and what will be the next round?
This current round, if we go a little bit more over funding, would take us all the way through past regulatory approval. And the next round, I'm in two minds. The current plan shows we only need about 400,000 to get right through to break even. But it's been so good, and people overfunding us for the moment. If that continues, then we might indeed accelerate even more. So I'm talking about earlier commercial times here. We could even go stronger on that and possibly go out for more production money. So it would be more money to take us internationally quicker.
Okay. And you're at about 325,000 committed to this round. The
Yes.
overfunding limit, if I'm correct, is about 490,000?
Yeah, well, in sort of rough terms, 500 is
Okay,
the
excellent.
target.
You mentioned previously about a few of the lead investors in this round, but did you want to talk a bit more about the experience that they bring? So David Mobbs, Brian Linden, and Subraj?
Yes, we were delighted when those three came in at the beginning of this round because they were new investors, and one in particular was CEO of Nuffield Group for 12 years. And it is management of hospitals that are going to make a great difference to us. The radiotherapists, the clinicians get what we do and they want to do it, but of course you still have to convince management and the health economics argument. So the experience that he brings is very important. The other two are investors in medical investment area. So they bring, in a sense, a wider view of who invests and what it is they invest in and what is attractive to other investors. So that group, just as a beginning, because that was quite a chunky investment, really helps us. And they have encouraged us, because we got testimonials from at least one of them. And generally, I talk to our investors whenever I can. So really positive. It's broadened our network and our ability to get that really good information.
Okay. When the round is done and when the regulation is completed, obviously you talked about a potential next round, but the product will be ready for market. How are you aiming to distribute the product?
Right. Absolutely initially, it will be direct, because we've got hospitals knocking at the door, including France and in Germany, but that would be 1 or 2 hospitals. Very quickly, and that's part of the exhibition next week, is to find distributors, medical distributors for the EU especially to start with, and monitor what else, because we will go to the States, but probably not for another year, 18 months, because we need FDA approval. Not that more difficult than here, but a tiny bit more. So distributors are the key companies to go for in this next year.
Okay. There was a good question from the Q&A online that I just wanted to ask, because I think it is pretty important. India and China represent fantastic markets to go after. They're very large, but they are also countries where there are a lot of challenges around the IP. How do you plan to protect yourself in those markets? Okay,
we've taken a view that India and China are very important in the long term, especially to this business. And therefore, we have taken out national patent in India and China, as well as the EU and the USA. And that means we now have patent agents working for us in India and in China, and that's very important. And secondly, it's already given us some interest with other medical companies that have started to say we're quite interested in this. In China, and we've got a few contacts there now, they're starting to say, as this is not a consumer product, it's much less likely to be duplicated and taken advantage of. The hospitals, even in China, want regulated, approved products, and they're not going to risk stuff from the guy around the corner in general. That's what we've been told, and certainly what we're working on. So we have agents now in India and China to help us.
Okay. Given that you have the agents there, does that mean that the patents are granted, or are they pending?
No, they're still not granted. They're in the national phase. So EU, USA, India and China are examining now. We've had questions back from the EU, we've had questions back from the US, which we turned around, that's okay. And they look as though they might well come to fruition at the end of this year. China typically takes another couple of years to get organised, and India's been known to take 10 years. So we'll just wait and see what happens there.
Okay, thank you for that. There's a question about the valuation. So the last round last year was at a 1.2 million pre-money valuation.
Pre-money was 1.2 when we started, yes.
1.5 post.
Yes.
And this one is pre-money effectively double that.
Yes.
How did you arrive at that valuation?
Well, as you know, there's various ways of arriving at valuations, and of course, on exit, it's about what you find that you agree with someone who's going to buy it. In this particular case, we looked at our plan and worked backwards a bit from that, and that gave us something like a valuation could be in this time even up to 6 million, but we thought that was over the top. So we stuck at 3 and then went and talked to our current investors, and half of them followed with preemption at this valuation, and nobody moaned about that valuation at all. So we felt, with perhaps we had 20 investors roughly that followed, that was justification for it. So in a way we tested it and got on with it.
Excellent. Just one more question. If you could talk a little bit more about the grant that you received back in March.
Yes, well, because when I pitched before, we had the notification of a grant, but we hadn't actually had the grant letter, which formalises it. So since then, we've actually finally had the formal grant of 189,000 over 2 years. And not only that, we've had the first progress meeting with Innovate UK, and we came through that with 2 gold stars, as the lady said, and our first claim is in and accepted. So for us, it's the first time we've got a grant of that nature, so it was useful to learn how to do it, but that's underway. That's to do with our 3D product, the balloons, the beads on a balloon.
And is that the, oftentimes when you get these grants, you'll get a small amount up front with potential for more later on from the same group. Is this a one-off grant, or is it one that has potential for follow-on?
This is a one-off grant for the minute, but it's over 2 years.
Okay.
So this quarter, just getting going, is only about £15,000 or £16,000 actual grant money that comes in, but that builds up to about 30,000 for most quarters going on. There isn't a direct follow-on, but this is called the biomedical catalyst early stage, and there is a biomedical catalyst late stage which people can then go into. So people that have gone through the early stage work stand a much better chance of getting the late stage grants as well.
Excellent. Well, that is all the questions from my end, so back to you, Katerina.
Thank you very much, Tom. And thank you, Nigel, for your time today.
You're welcome, thank you.
And thank you, everyone at home, for tuning in. If you do have any further questions, you are able to submit them on the Q&A page online. Thank you and have a lovely weekend ahead.